Hello, everyone, and welcome to today's webinar highlighting how the Healthwell Foundation supports patients through its comprehensive programs and services. We hope you will walk away from this video with more knowledge on the financial support that Healthwell provides and how pharmacists can access their resources. My name is Clarissa Wilkins, and I will be your host for this webinar. I currently serve on the Patient Outreach and Education Committee with HOPA. Today, I am joined by Audrey Cordy, who is the Director of External Relations at Healthwell Foundation. Audrey, thank you for being here today.
Hi, Clarissa. It is a pleasure to be here today, and thank you so much for inviting Healthwell Foundation to introduce our programs to HOPA members. So the Healthwell Foundation is a nationally recognized independent nonprofit organization that serves as a financial lifeline to over 1.1 million underinsured individuals across more than the 95 disease areas that we offer. So for over 20 years, we have been steadfast in our mission to reduce financial barriers to care for underinsured patients with chronic or life-altering diseases. And since its founding, we have issued over 1.8 million grants, totaling over $4.8 billion in financial assistance. So when health insurance is not enough, Healthwell fills in that gap by assisting patients with their out-of-pocket cost for co-pays, co-insurance, and deductibles for their prescribed treatments that they otherwise wouldn't be able to afford. But additionally, we also help patients pay for their Medicare Part B health insurance premiums, and we cover other healthcare expenses that a lot of people don't know about at times, such as general travel, pediatric treatments, vitamins and supplements, and behavioral health, and more.
So we know Healthwell offers programs that cater to various conditions, but could you please share more about the oncology-related funds you currently have available for these patients?
Absolutely. So we currently offer 40 disease funds focusing primarily on oncology. So out of the 95 disease areas that we support, about 40 of those are oncology. So you can see it's almost half of what the funds that we have. But some of our open funds in oncology include multiple myeloma, we have chronic lymphocytic leukemia, renal cell carcinoma, and more. But additionally, we introduced the Cancer Home Care Services Fund, which helps cover the cost of home care services, devices, and durable medical equipment. We also have a behavioral health fund specifically for oncology patients and their caregivers to provide financial support for mental health. And across our 40 oncology funds, we've awarded nearly 400,000 grants to individuals living with cancer and paid over $2.4 billion to assist out-of-pocket costs for co-pays, co-insurance, deductibles, and health insurance premiums. So as you can see, we're very committed to supporting oncology patients and ensuring that those already undergoing the stress of cancer treatments do not have to worry about the out-of-pocket costs for their prescribed treatments. I have a question for you, Clarissa. We know that pharmacists play a vital role in helping patients access their medications, especially those patients facing the additional burden of financial toxicity. Can you share some examples of the tasks that you do on a daily basis to make sure patients can afford their medications?
Yeah, absolutely. So at my health system, we follow several disease states for funding for our patients and try to keep up to date with all the open funds. We currently have Healthwell portals through our provider's office to facilitate enrollment while the patient is in the clinic to make sure that there's no delays in providing that medication access to our patients. It also helps that the Healthwell website is a great portal and is very user-friendly. We also maintain thorough documentation of expiration dates to make sure that there's no lapses in funding for our patients. We actually have automatic follow-up tasks built in within our system to ensure that any funding renewals or patient assistance programs are addressed proactively. And then we have our liaison technicians who are also positioned within the clinics to be a part of the healthcare team and to assess with these tasks.
Wow, it looks like you have a robust program to go above and beyond for your patients to search for charitable patient assistance programs like Healthwell and other organizations that also offer financial support for patients.
Yes, we are very grateful that there are organizations like Healthwell out there that can help our patients cover the costs of their cancer care. And Audrey, could you please tell us a little bit more about what eligibility requirements patients must meet in order to receive a Healthwell grant?
Definitely. So our eligibility is based on individuals' financial, their medical, and their insurance situation. So to be eligible for a grant from Healthwell, first we look at the diagnosis, then we look at treatment. So the individual must have a confirmed diagnosis of the disease for which they are applying for funding, and they must be undergoing treatments. So, for example, if you're applying on behalf of your patient for, say, the Multiple Myeloma Medicare Access Fund, the patient must be undergoing treatment specifically for multiple myeloma. And second, their medication must be on the list of our covered treatments. The third criteria is that the patient must have health insurance coverage, either through their major medical or through their prescription drug plan. And additionally, certain funds are limited to Medicare access recipients, so it's important to verify that information before you apply. And then the fourth requirement, which is the last, is that the household income must fall within 500% of the federal poverty level. And this also depends on the disease fund. So you can visit our fund page, or you can use the eligibility tool on the homepage of our website at healthwellfoundation.org to determine the FPL and all other eligibility criteria in just 5 quick, easy steps. I have one other question for you. So I wanted to find out, how do you and other oncology pharmacists typically identify patients who may benefit from support through programs like Healthwell?
I know, at least on my side, we have an extraordinary team that will process the patient's benefits to assess copay needs for any of the patient's chemotherapy. We do a benefits investigation first, and then any remaining copay, we strive it to be as low as possible for our patients. And our goal is to have each patient have affordable treatment. So if one medication is too costly, the pharmacist, of course, can follow up to ensure that their continuity of care is received.
Excellent. It's great to know that you have, some kind of screening tool in place to just determine eligibility for patients.
Yeah, and pharmacists are in a perfect position on the care team to help connect patients to resources like the ones that you offer. How can pharmacists and pharmacies help patients apply for a Healthwell grant?
Yes, so HOPA members can assist eligible patients in applying for a grant through our portals. It's really a one-stop shop. You can do anything there. You can enroll, you can re-enroll, you can check payment status. But in addition to that, you can even send us an email through the portal. So it's a great tool to use. We recommend that all our pharmacists use this tool to be able to help manage their patients in one place. You can access the pharmacy portal on our website, or you can go to healthwellfoundation.org/pharmacy portal. You may also contact our dedicated support team at 800-675-8416, Monday through Friday from 9 a.m. to 5 p.m. Eastern Time. One thing I do want to point out, though, about our application process, it is very quick, it's easy and accessible, especially for those that need additional support. So it takes less than 10 minutes to complete the application, and you will know instantly if you've been approved. Once you're approved, you can start using the pharmacy card information immediately to bill Healthwell, allowing you to be able to fill the prescription and to be able to help the patient avoid interruptions in therapy.
So, Audrey, what can pharmacists or the patients do if the fund is closed?
Healthwell offers a tool called the Real-Time Fund Alerts, which provides instant notification to help users track the status of Healthwell disease funds in real time. Now, when funds open or close at Healthwell, we will notify you via text, call, or email, depending on what notification feature you selected when you were enrolling. Now, as you know, some funds open and close very quickly, so this tool notifies you in real time, and that's the operative word, real time, allowing you to be able to apply quickly.
And does Healthwell offer any resources that pharmacists or pharmacies can keep on hand to provide to their patients?
Yes, so in addition to our real-time fund alerts, we offer patient brochures available in both digital and printed formats in both English and Spanish to help patients navigate our programs. Pharmacists can request printed copies through our website. We also offer overview webinars as well as live portal demonstrations to just help you better understand our services and how to make the most out of the tools that are available to you. You can reach out to me at providers and pharmacies at healthwellfoundation.org if you're interested. And I also want to point out that we have a dedicated resource page on our website that lists travel and behavioral health resources, as well as patient support organizations who provide resources for the uninsured and underinsured patients, and even much more information. You can also learn more about Healthwell Foundation and support our mission by visiting our website at healthwellfoundation.org for the latest news. You can also watch our videos. You can subscribe to our real-time fund alerts tool and our real-world healthcare blog, or you can make a donation or connect with us on social media.
Audrey, thank you for all the wonderful information you provided today. We have one last question for you related to some looming policy changes that were passed in 2025. Can you touch upon the upcoming Medicaid and Medicare cuts that were recently approved by this administration and how that can impact our patients and the grants available at Healthwell?
Thank you, Clarissa. That's a very important question. Actually, according to the Kaiser Family Foundation, that many will lose their Medicaid insurance and become uninsured due to the stricter requirements, such as work mandates, and also result in many getting disqualified or forcing many to enroll in the marketplace plans. But with the phasing out of the marketplace premium subsidies on December 31st, this could also make many marketplace plans unaffordable. So currently, Healthwell assists with Medicare Part B insurance premiums, and we're exploring options to be able to help with other premium costs. In addition, those that remain on Medicaid may face increased cost sharing requirements, which could also lead to greater need for copay assistance programs like Healthwell Foundation. And so we are also exploring ways to make our Medicare access funds available to Medicaid and TRICARE patients. And then finally, as we all know, the Inflation Reduction Act remains in effect, capping out-of-pocket expenses at $2,000, which is great for Medicare beneficiaries, and it's actually allowed us to be able to assist more patients. But there are uncertainties, of course, surrounding all of these changes that are taking place.
Audrey, thank you again for joining us today to share more about the resources Healthwell offers patients. To our listeners, we hope you found this information valuable and that it will provide benefit and it will prove beneficial as you are helping your patients access the support they need. Please visit healthwellfoundation.org to access the resources mentioned during this video. And don't hesitate to reach out to Healthwell Foundation or HOPA at advocacy@hoparx.org if you have any questions. Have a wonderful day.
Thank you so much, Clarissa. Have a great day.